Every now and then you hear older folks asking each other, hey, Jay Shaker, get shaker, Jay Shaker. Many times they're not talking about actual sugar, they're referring to diabetes, a chronic metabolic disease that seems to be on the increase. People are being diagnosed at alarming rates in both the developed and developing nations. Now, to help make sense of things, we've actually decided to tackle diabetes mellitus on today's show in preparation for World Diabetes Day, next Thursday, the 14th of November.
So diabetes is a growing problem globally. It's increasing in every country in the world and also in South Africa. The International Diabetes Federation estimated that by 2030 there would be about 366 million patients with diabetes globally. Unfortunately, that value was reached in 2011. So they've re-estimated it, and there's expected to be an increase to about 552 million people with diabetes globally. The majority of that increase is going to be in low and middle income countries such as South Africa and the rest of Africa. And Africa is going to see a 90% increase in the numbers of patients with diabetes. Currently, the International Diabetes Federation estimates there are about 371 million patients with diabetes. If one puts that in perspective and we compare it to another pandemic such as HIV infection, where currently there's about 33.5 million patients with HIV, one can see that for every patient with HIV infection, there's about 10 to 12 diabetics globally. Diabetes, and especially type 2 diabetes, is predominantly a lifestyle-driven disease. The major part of the lifestyle is diet and exercise, leading to weight gain. So there's no doubt that there are some patients with type 2 diabetes that can actually be cured if they just lost weight. The consequences of poorly controlled diabetes are unfortunately quite severe. Diabetics are the major contributors to dialysis lists globally. They're the major contributors to amputation lists globally. It's one of the major causes of blindness globally. And it's also one of the major risk factors for cardiovascular disease, such as heart attacks, and also cerebrovascular disease such as strokes. The important thing to note though is that all of this is completely preventable. We are the most obese nation in Africa. So things have to be put in place now to curb this problem.
Now with me to unpack diabetes is our regular panel, Dr. Lerato Masemola, Dr. Darren Green and Lisa Raleigh. Welcome to Doctor's Orders. So let's talk about diabetes. What's the definition of diabetes, Darren?
Sure. I think it's the tendency to have uncontrolled blood sugar levels.
Yes.
And the full-blown clinical syndrome of diabetes refers to just that. And there are obviously many different things that lead to it, but an inability to sustain a controlled blood sugar level.
And what are the different types of diabetes?
Well, you have type 1 and type 2. In type 1 diabetes, mainly genetic, happens in the juvenile patients, meaning the younger ones.
Yes.
And the pancreas does not produce insulin.
Yes.
Therefore, they need insulin to inject it into the body so they can then regulate their blood sugar that way. Type 2, however, usually later onset, lifestyle driven, and here the pancreas doesn't produce enough or produces enough, however, the body doesn't utilize it properly because of damage to the receptors over time. And I said it happens in the later years, but it's actually they're starting to see it in the younger people now because of our poor lifestyle choice.
So who's at risk of developing diabetes?
Obviously, if there's a genetic link, so if your mom or dad had it, certainly, or your grandfather or mother. And then also we have to look at people that are obese.
Yes.
For type 2 diabetes, people that have hypertension, and people that are sedentary and really don't burn enough sugar.
You know, you don't have to be overweight to be at risk either.
Yes.
Some slim people also have diabetes, and dieters can also suffer from diabetes. So for those people that dieters, because they are constantly not eating breakfast, they're skipping meals, their blood sugar is all over the show, they're starving their bodies of calories, really. So you start causing havoc with your metabolism. So you don't have to be big. You can be really slim and be living with type 2 diabetes because it's a lifestyle-related thing.
So what are some of the symptoms that people may experience who are actually developing diabetes or who should be concerned about that?
Well, to make it easier, just think of the 4 Ps.
Four Ps.
Yes, the first P will be for polydipsia. That's when you're very thirsty, so you drink a lot of water.
Yes.
Polyuria, you have to urinate quite a lot. And in polyphagia, very, very hungry. And the other P is for plus. because not everybody will experience an illness in the same way. So you have other various illnesses and symptoms you may feel, such as extreme fatigue, dryness of the skin, among others.
There are also some people that complain of low sugars.
Yes.
When they get jittery, they just feel flushed, sometimes warm. They speak of that. And then they feel a bit jittery, shaky, and then they want to rip a sweet out of their handbag, for
And they can't
example.
concentrate
Yes.
either. Feel
That's also
lightheaded
important.
and
Yes.
dizzy.
So diabetes, so it's got uncontrolled sugar in the bloodstream. Now, what are the complications of this uncontrolled sugar?
Chronic high sugars damage the inner lining of the blood vessel, and that changes the structure and affects the blood flow through that vessel later on. You then develop a shortage of oxygen and nutrient delivery to the different tissues, to the
Yes.
muscle, to the nerve. You get the different complications. So the small vessels, the eyes, the kidneys, the big vessels, amputations, a loss of a limb, a loss of a finger, for example.
So what are the common complications of small vessel damage?
Well, Darren mentioned the eyes. You get retinopathy,
Yes.
where there's damage to the retina, and therefore there goes your eyesight as well.
Your eyesight is
yeah,
damaged.
so even with the other smaller blood vessels may also be in your peripheral parts of the body, your legs and your feet, where you get tingling, because now your nerves, they will also get affected from
Yes.
the poor blood supply. But also because of that, you can injure yourself and not see, so you end up with
Yes.
ulcers, and which may now also in time lead to amputation because of infections that cannot be cured, and those parts of the body then die. Once gangrene sets in, it's very difficult to cure. Of course, we must not forget about the most important organs in the body, your brain and your heart. So the blood vessels, they also get damaged, and you end up with strokes and also with heart attacks. And there are other systems in the body that can also be affected.
Now, Lisa, from a lifestyle perspective, how do people prevent diabetes?
First and foremost, you need to reduce your weight.
Yes.
That is going to increase your risk. So even 5 to 10% of your total body weight will reduce your risk. Also reducing blood pressure. So by that, I mean reducing salt intake. And then exercise and nutrition. It always comes back to those two things. Exercising for 30 minutes a day, walking, swimming, cycling, any kind of movement where you're getting your heart rate up.
As a guideline.
Exercise is a fantastic way of getting rid of excess blood sugar. So it actually does similar to what insulin does, but in a natural way. And then when it comes to eating, the low GI diet is going to be the best diet for you to follow. So lots of fruits, lots of vegetables, together with a low GI diet, and making sure that you eat frequently. So calorie controlled, portion controlled, 5 to 6 small meals a day. Don't skip meals.
Don't skip meals.
Yeah.
So since I've actually skipped a meal and I'm guilty of doing this all the time, Lerato, why not test my glucose at this point? And Darren can tell us a little bit about the management, the medical management of diabetes in the meantime.
Sure. Normally people start off with diet modification, as Lisa pointed out, but the medical management includes oral anti-diabetic medications like metformin and glucophage, common names, and then you have the insulin itself as well. Now often type 2 diabetics start off with the oral medication, and if sufficient control is gained of the blood sugar levels, they don't need to supplement with insulin. But, we do regulate this over a period of 3 months by a simple blood test as well.
So, Lerato, I see you're ready for me over there.
Yes, so what we have here is a basic home test, so people with diabetes can use this at home to check how their sugar control is going. Give me your hand. So we have the lancets. Most of the tests comes with lancets to prick the skin, and then you have the strips that look like, most of them was something similar to this, and then you have the machine itself, okay? So
Hope you're ready,
This is
Rian. I hope
I'm
it's a
ready.
good result.
I hate these
Hey, Doc.
swabs.
Always make sure.
I hear your heart beating from there.
Always make sure you're using and something aseptic, like an alcohol swab or something that you can clean with at home, because you don't want to now be pricking your fingers all the time and then introducing infections from outside to inside, okay? Very important.
Darren, can you hold my hand, please? Hold my hand, please.
Oh, look at that moment.
Think happy thoughts.
Luckily, he bleeds very quickly and easily.
Wow. He's a bleeder.
And these tests are generally very easy. You put the strip in, it indicates to you to put the blood drop inside. And he passed the test.
Woohoo!
He skipped a meal off the hook
Well
this
done,
time.
Doc.
Your sugar is 4.8, which is within the normal range.
Very good. I'm impressed. Woo!
And I'm going to do the other hand.
Look, now I'm gonna do the other hand. How about you do one? Yeah.
Yeah, we should do you next.
So my screening test is normal. You can actually have this test done at your local pharmacy, or you can even purchase it.
Yep.
Thank you guys for joining us on Doctor's Orders. There are many dedicated and passionate individuals striving to educate South Africans more about this disease that we have the power to manage and even to prevent. We take a look at Sweet Life magazine and look at how they have been inspiring South Africans to live a healthier life.
6 years ago, almost to the day, I was diagnosed with type 1 diabetes, and I was really ill. I was rushed straight to ICU, and my doctor at the time told me that I was 3 days away from a diabetic coma. There's 5 classic diabetes symptoms. I'd lost an enormous amount of weight. I was really hungry and eating more than I'd ever eaten in my life. I was constantly thirsty, drinking all the time, having to drink at night, having to get up in the night to pee, needing to pee all the time, and I was exhausted, like bone-weary exhausted. And my eyesight was going a little funny. So I was very lucky in that I was able to be diagnosed by doctors who really knew their stuff, and I was able to recover in a safe, comforting environment. But all the information I was sent home with was absolutely terrifying. Everything told me that I was pretty much now, I'd been given a death sentence. And if only someone had said to me, if you're in good control, there's nothing you can't do. So that desire for an inspiring take on diabetes is what sparked off the idea for Sweet Life. And so Sweet Life magazine was born in November 2011, and we distribute it around South Africa through Clicks clinics and local support groups, and it's free. That's really important to us, that it gets to everyone who needs the information. And one of the really important things for us is that all the information that we share is medically verified. So we have an amazing panel of experts, of doctors and endocrinologists and podiatrists and dietitians and anyone who is an expert on any aspect of diabetes. And they check every article that we send out to make sure that the information is correct. It's a diabetes lifestyle magazine, it's not a medical journal. So although all our articles are medically verified, we recognize that diabetes isn't just a medical condition. It's a chronic condition, it's with you for life. So you have to find a sustainable way of living with it so that you can live with it happily for life. You can live a perfectly normal life with diabetes. You don't have to be on a crazy diet. There isn't actually a diabetic diet, they've now told us all. You should just be eating what all of us should be eating. Lots of whole grains, lean proteins, a moderate amount of carbohydrate, minimal alcohol, no cigarettes. It's all the stuff we all know. But as a diabetic, you just have added impetus because it's really important that you follow these guidelines. And that's the message we try to convey. You can live a perfectly normal life, just make sure you're well informed. Keep your blood sugar as tightly in control as you can, but don't make it your whole life.